The APN role we will be discussing is primary care nurse practitioners. In the 1960s, the nurse practitioner role emerged and transformed primary care and nursing. Nurse practitioner role was transformed as a profession in 1965. The expansion of Medicaid and Medicare allowed more coverage and the need for primary care providers. The role of the primary care nurse practitioner now focuses on care of all types of patients, from pediatrics to geriatrics. In 2017, there are more than 234,000 nurse practitioners licensed in the United States, and 89.2% are certified in an area of primary care. Primary care nurses help provide care that is safe, effective, and suitable to patients. They work with all populations, including the vulnerable, ethnic or racial minorities, and the disadvantaged. This APN practices health promotion, disease prevention, health protection, anticipatory guidance, counseling, disease management, and palliative care. Care coordination is essential for practicing primary care nurse practitioners as they work closely with patients' other healthcare providers, coordinating and managing care transitions, referrals, and the information that is exchanged. Primary care nurse practitioners are prepared through a graduate program, receiving either their master's or doctorate degree. These programs include educational and clinical courses to provide graduates with knowledge and clinical primary care competencies. According to the AANP, most primary care nurse practitioners are practicing in hospital outpatient clinics, hospital group practices, and private physician practices. Primary care nurse practitioners help address the primary care need within the United States and are more likely to work in rural areas. Primary care nurse practitioners' scope of practice blends nursing and medical services. They are able to diagnose, manage acute and chronic conditions, and emphasize health promotion and disease prevention. Medical services can include ordering, conducting and interpreting diagnostic testing, prescribing pharmacological and non-pharmacological therapies, and teaching. While each state may have a varying restriction and scope of practice, most nurse practitioners practice autonomously or in collaboration with other healthcare professionals. Competencies and standards of care include direct clinical practice, guidance and coaching, consultation, evidence-based practice, leadership, collaboration, and ethical decision-making. Clinical practice. Primary care nurse practitioners deliver direct care to patients and families. Direct clinical practice for PCNPs includes managing previously diagnosed and undiagnosed, increasingly ill and complex patients at a fast pace. Clinical practice for PCNPs also includes caring for the growing numbers of aging patients with a large range of chronic diseases and multiple comorbidities. PCNP's direct clinical practice requires the proficiency to address behavioral health problems and socioeconomic challenges that stress many families. They have the ability to analyze data and integrate their knowledge to improve their practices for the health and lives of the individuals, families, and the whole community. Guidance and coaching. A primary nurse practitioner's competency in regards to coaching and guidance are a continuation of that of the registered nurse. Since most nurse practitioners have had patient care experience in this role, it allows them to further build on their skills and their ability to create trust and rapport with their patients. This bond that is created in the primary care setting is critical because ideally this relationship between the patient and the practitioner will be long-term. If an appropriate, comforting relationship is formulated right away, this can carry over and enhance the way you care for them with their future healthcare needs. Careful listening to the concerns, complaints, and the overall story of the patients gives the practitioner an opportunity to coach them using techniques, language that will be most effective for the individual needs of the patients. Patients must be the center of care for guidance and coaching to be effective. In today's world, there are so many resources for communicating with patients and providing them with comfort of knowing their practitioner is available to listen to their concerns. Telemedicine is a great resource that has become more popular in recent years and allows the practitioner to ease worries of patients and coach or guide them towards their healthcare needs from the comfort of their own home. It is important to be able to utilize all the resources available in order to gather as much data as you can about the patient's story, and then use that knowledge when you are building a plan for how to best coach and guide them. Consultation. Using professional language, both orally and in writing, is critical when establishing relationships between fellow providers and other associates in the healthcare field. When participating in consultating activities, the PCNP is frequently called upon to provide expert advice on facility policies, organizational structure, finances, patient care processes, and other examples. The impact that PCNP's advice can potentially have on the team and the patient should be on the forefront of the provider's mind, and the utmost respect and concern should be given to the topic that is being consulted on. However, there are certain circumstances where less formal exchange of ideas can be utilized as a comfort and effective way to communicate with colleagues. It is imperative that as a provider, you hold yourself to a high standard so that you can be counted on, respected, and trusted to participate in any and all consultative activities. Evidence-based practice. Primary care nurse practitioners utilize middle range theories to guide their assessments, decision making, and interventions. PCNPs use evidence-based practice competencies to improve their practice processes and outcomes. They can integrate research, theory, and practice knowledge into their practice. PCNPs measure the outcomes of their practice and make adjustments as their outcomes are heavily influenced by underlying factors. Primary care nurse practitioners play the lead role in community as members on the boards of health and education and community organizations as influential policymakers. The PCNP position provides the ability to lead healthcare teams and generate new advanced practice changes. PCNPs assume the advanced leadership roles to initiate and guide change. They develop and implement the innovations that incorporate principles of change to advance practice and promote health at all levels. PCNPs show leadership as they guide and support staff, triage patients, coordinate care, and lead interprofessional teams. Primary care nurse practitioners use professional collaboration to deliver integrated and accessible care. PCNPs use effective collaboration with interprofessional teams for more comprehensive, patient-focused care to promote high-quality, cost-effective outcomes. They use effective collaboration with interprofessional teams to improve institutional performance through processes such as quality improvement and purpose solutions. Decision making. Working in the healthcare field means that as a provider, you will undoubtedly encounter scenarios that instigate negative emotions in patients, such as anxiety, fear, powerlessness, and vulnerability. It is essential to have confidence and knowledge required to resolve ethical issues that arise in your role. Choices having to do with finances are routinely a source of turmoil and tension in the healthcare field, and in life for that matter. Placing your accountability to the healthcare system and to excellent patient care should be at the top of your priority list and is imperative. Oftentimes, there are financial incentives that present themselves, and it is important to use your ethics as your guide when you are deciding whether those incentives are appropriate. There are many other ethical decisions that need to be made aside from finances. Reproductive issues, informed consent, end-of-life issues, conflict of interest on the part of the providers, conflicting healthcare goals among family members, as well as lack of equality, social disparities of health, and in some cases profound suffering, are just a few examples. Being aware and sensitive to moral concepts related to culture and diversity is a required practice of PCNPs. Having a strong sense of comfort in your knowledge of the ethical principles in the nursing practice can help when you are evaluating complex circumstances in which an ethical decision needs to be made. Role challenges. As more healthcare providers aim to avoid incurring CMS penalties based on the new Medicare and Medicaid reimbursement methods, nurse practitioners will have to do their part to help reduce hospital readmissions. Luckily, they're in an excellent position to do so with their traditional emphasis on teaching patients and caregivers appropriate home care and aftercare techniques. Helping reduce fragmented care will also fall heavily on nurse practitioners. Those who work in traditional private practice can make a tremendous contribution, however. By helping ensure that the patients receive medical care in a timely manner, they can reduce the number of patients who turn to expensive one-off care choices, like emergency room visits. Practicing to full capacity is always a challenge for primary care nurse practitioners as well. Some states allow nurse practitioners to practice on their own, while some states still want a physician to sign off on their work. The future of primary care nurse practitioners. Future outlook of APRNs in the workforce is excellent. Overall, APRN employment is projected to grow 26% from 2018 to 2028, according to the U.S. Bureau of Labor and Statistics. This rate is more rapid than the growth projected for all other occupations. Growth in this field is occurring as a result of an increase in demand for various healthcare services. In recent years, we have witnessed an increased emphasis on preventative care in addition to health care for our aging population. The enacting of the Affordable Care Act also brought millions of previously uninsured people into the healthcare arena. The need for advanced practice providers in the hospitals, clinics, and ambulatory care clinics is expected to increase dramatically. The aging population presents with complex chronic conditions that require frequent medical encounters. The U.S. Bureau of Labor Statistics also predicts that 16,900 openings for nurse practitioners, 3,200 openings for nurse anesthetists, and 500 openings for nurse midwives yearly over the course of the next decade. Many of these jobs are expected to also rise from medical providers leaving the workforce due to retirement and transfer to different occupations. The IOM report indicates advanced practice registered nurses should be able to practice to the full extent of their education and training. This recommendation and the multiple systemic healthcare changes occurring secondary to the United States 2010 Patient Protection and Affordable Care Act make this an optimal time for full use of nurse practitioners in ways not realized previously. This role describes the evolution and the future of the NP role. There is an increasing demand for APRNs, especially as primary care providers. Under current laws, state regulations cause limitation of APRN's scope of practice. The APRNs are also limited from practicing across certain state lines. These challenges prevent APRNs from practicing to the full extent of their training and education. In order to meet the growing need for APRNs in the workforce, there must be more uniformity in regards to the profession as a whole. Two significant changes are being considered by national credentialing, educational accrediting, and state licensing bodies. The first change is the nationwide regulatory census model. This model will create uniformity among the licensing qualification requirements and scope of practice for APRNs in all states and territories. The second is the advent of establishing the Doctor of Nursing practice as the educational requirement for national certification in all advanced practice nurse roles and for APRN licensure. Changes to certification exams to align with the census model are in process. The Association of Colleges of Nursing proposed that the recommendation that the DNP be used as the minimum practice-focused degree required to become a licensed APRN by 2015. This date was abandoned because many nursing schools did not have a DNP program in place. In conclusion, APRNs have proven they are effective in delivering high-quality care and have been able to lower healthcare costs. According to the American Association of Nurse Practitioners, patients who see NPs as their primary care provider have fewer emergency room visits and enjoy lower medication costs. The AANP also states that 1.06 billion visits are made to APRNs each year, with patients reporting an extremely high level of satisfaction from the care they received. In addition, nursing continues to prevail as the most trusted profession. APRNs are a vital component of the healthcare system. They guide, coach, consult with other disciplines, employ evidence-based practice, and use ethical decision-making. APRNs help to bridge the gap in the primary care shortage in America. Job growth is projected to be excellent over the next decade, and the scope of practice is beginning to change and become more uniform across state borders.